Good afternoon. Thank you. Someone just yelled happy birthday. Thank you. So thank you for tuning in. I look forward to seeing you, having the opportunity to talk with and address the concerns of the people of Rhode Island every day at 1 o'clock. We'll be here every day at 1, except on Wednesday, we'll be here at 2:30. So this week, every day at 1 o'clock, except Wednesday is at 2:30. So we begin, as we always do, by having a quick look at the data, which should be up on your screen by now. And it's some good news. We have 121 new cases, so that's a nice drop. I've been waiting for the day that we would finally see a bit of a drop. Tested almost 3,000 people and 121 cases. That is a good thing. Very sadly, another 7 deaths, and every one of those is significant. And our hospitalizations are holding steady or declining. So all things considered, considering where we were a few weeks ago and where we are now, I look at that data with confidence that we're doing the right things, with gratitude that the people of Rhode Island are following the rules, even though the rules are not easy to follow. And with optimism that if we keep seeing data like that, we're going to be getting on with our lives as soon as possible, as soon as we can. So I would just remind you, even though we've been at this for a very long time, we need to stay at it. You know, this mask wearing is here to stay for a while. Constant hand washing is here to stay for a while. Keeping 6 feet apart, not leaving your house if you're sick, calling your doctor and getting tested if you feel sick, keeping your contact tracing notebook. You know, I'm hoping that by now this is just a part of the way we live life. You know, you don't leave your house without your phone or your wallet or your keys. Don't leave your house without some hand sanitizer and a mask. You wouldn't think before of leaving your house if you were really very sick. I don't want you to leave your house now if you're even a little bit sick. We're going to be living with the virus for who knows how long. It could be a year if it takes that long to get a therapy or a vaccine. Hopefully it's not that long, but this is it. This is life. And the quicker we just follow the rules and live life this way, the better we'll all be. I will say we had a good weekend. Parks were open. There wasn't a great deal of crowding. We had excellent compliance in retail shops, particularly with mask wearing. I was heartened by the weekend numbers. People were out shopping. That is a good thing. But they were wearing their masks. They were waiting in line. They were staying 6 feet apart. And retailers, God bless them, are really adapting to this new way. They're enabling touchless payment. They're keeping folks apart. They have markings on the ground to keep people 6 feet apart. So I want to thank you all for all that you have been doing. I have a handful of announcements today related to a lot of questions we've been getting on, you know, when will this reopen? How is that working? So bear with me as I tick through a handful of important announcements. So one of these announcements relates to our beaches. Obviously, Memorial Day is coming up. Memorial Day in Rhode Island is a big deal. We're the ocean state. Our beaches are part of who we are. I grew up going to the beach every Memorial Day from the time I was probably 2 years old, and my children the same way. And we all look forward to it, along with Memorial Day celebrations. The first voyage to the beach is kind of part of who we are. So out of recognition of that fact and the fact that it is a special weekend in our state, but also out of recognition of the fact that we're still in phase 1 and going slow and steady, we have decided that on Memorial Day, the Monday, we will be opening 2 state beaches, East Matunic State Beach and Scarborough State Beach. Now, when I say opening, it is not opening in a way that you would typically think of opening. There are only 2 beaches, the 2 that I've said. Their number of parking spots will be significantly limited. DEM is still working on the exact regulations. Those regulations will be out later this week online at reopeningri.com. But you could expect very reduced parking. The bathrooms and shower and changing rooms will be closed. There'll probably be, porta-johns in the parking lot. The concession stands will be closed. There will not be lifeguards. On the flip side, you will not have to pay. We will not be charging. So this is really a very limited reopening of these two beaches, so that if you and your family typically have a tradition of going to the beach on Memorial Day, you can still do that. You could go for a walk. You can, take the kids to the beach, go for a walk, put your feet in the water, but it'll be in a very limited way. Also, as of today, all of our state parks are open. Goddard Park had been closed. It is now open. So we'd encourage you to, take your family for a walk. I know that's an incredibly important park, especially in that area of Rhode Island. So again, we want people to go outside, get some fresh air, enjoy nature, enjoy our beaches and parks, but all the rules will apply. 6 feet apart, not except if you're with your family, obviously, but stay away from other folks. Don't stay too long. And again, bathrooms and concessions will be closed at the beaches. It is our hope that when we enter phase 2, which will be very soon thereafter, we will open all the beaches, again reduced, but all of the beaches will open. So you can go on the website probably Wednesday, Thursday of this week, reopeningri.com, and get some more details around how you can enjoy the beach. I want to take a second. There's no particular order to today's announcements. There are various different things based upon what we're hearing from people, what's on people's minds. Beaches were on people's minds for Memorial Day. Another thing we're hearing a lot from are hairdressers and barbers and salon owners. And I just, again, want to acknowledge how hard it is to have your entire business shut down for 2 months. Fortunately, the federal government has provided for unemployment insurance for hairdressers and barbers and the self-employed, which has never before been the case. But I know that's not a substitute for being in business, and I hate the fact that we've had to shut you down, and we want to do everything we can to enable you to get back into business as soon as possible, as safely as possible. Having said that, this is a complex one, like all close contact businesses, so we're trying to seek a lot of feedback. And to that point, I want to announce that this afternoon, the Commerce team is hosting a Facebook town hall with hundreds of hairdressers and barbers and salon owners. Why are we doing that? Because we want to keep hearing from you. So if you hadn't heard about it, I'd encourage you to tune in this afternoon, the hairdresser Facebook town hall. We're going to have a discussion around what reopening hairdressers will look like when we enter phase 2. We want to get there as soon as we can, but we need to get there safely. And frankly, we need to hear from you. We need to hear from you on what you think you can do. It's not helpful for us to put out rules that you think are impossible to follow. So we need to meet you where you are and put out rules that you can consistently abide by, and also that keep you and your employees and your clients safe. So I'd encourage you to tune in to today's town hall. Also, we are in very close contact with Connecticut and neighboring states as it relates to hairdressers. And so we're trying to align to a certain extent with our neighbors. Another area which has weighed on me quite a bit personally is houses of worship. It's like so many families in Rhode Island, not being able to attend Mass on a weekly basis or attend religious services on a weekly basis has been really hard on our family, on our faith community, and on a lot of families. And we've had Easter, we've had Passover, we've had Ramadan, we've had Palm Sunday, all really disrupted. Having said that, churches, however special they are and however vital they are, they present particular risks, particularly in the Christian faith with the receipt of Holy Communion, particular risks, hymnals, folks crowding together, lining up in a communion line, lots of folks who are older and sick and frail. So we've really tried to balance people's needs and rights to worship with the realities of this public health crisis. And, you know, the fact of the matter is people are still worshiping, and many folks are getting creative, either with celebrating in their car, or many priests and rabbis are telecasting on Facebook or video. But the truth of it is the virtual celebrations or the drive-through celebrations, it's clearly not the same thing. And so I'm anxious to allow us to get back into our houses of worship. I want to, we have been working very closely with a group of religious advisors. We put together an advisory board of faith leaders from every faith around the state, and they have been working so hard with us, even this weekend, worked throughout the weekend to try to figure out how do we do this. I can't go through all of the thank yous because they are too many to thank, but special thank you to Monsignor Kenny from the Catholic Diocese, Bishop Jeff Williams, Pastor Lester, Rabbi Mack, Reverend Nigueras. You know, thank you guys and all your other colleagues on the commission for helping us out. After a great deal of consideration, thought, prayer, quite frankly, I have decided that we are going to target beginning in-person faith services the weekend of May 30th. So not next weekend, but the weekend after. That is our goal. Between now and then, we're going to work through the exact guidelines. I expect that those will be posted later this week on reopeningri.com. Exact guidelines around what's the capacity allowed in any one building at a time, what are the proper procedures for the Holy Communion. You know, there won't be allowed to be hymnals or papers in the pews. Churches will have to have, and places of worship will have to have particular cleaning, etc. Let me say this. I was asked to, you know, make this announcement today to preview for all faith leaders that I guess a week and a half from now, they'll be back at services because it's going to take some time to get ready. And we recognize that. Every faith leader is going to have to figure out how will you do the cleaning? How will you set up the church? Will you have to have more services during the course of a weekend in order to accommodate all of your parishioners, since there'll be restrictions on the number of people at any one time in a service? I feel relieved and grateful that we were able to come up with this as the weekend of May 30th. And I also want to say I have confidence. I've come to this decision because I have confidence in faith leaders. At the end of the day, it'll be the responsibility of the faith leaders to conduct their services in a way that is compliant with the regulations to keep their congregants safe. And frankly, up to each and every one of us to do the right thing. But I do have faith and confidence in our faith communities, and I trust you that you know the rules now. You know people have to be 6 feet apart. You know folks have to wear masks. You know the frail and the sick are especially vulnerable. And I want to thank you for your consideration in working with us. And I have faith in you that when the guidelines come out, you'll do everything you can to abide by them. A couple of other announcements. I have referenced equity many times as I've been up here in these daily press conferences, and I'm going to reference it again today. Equity is a core belief and value to which I am committed every day. My administration is committed every day, pre-COVID and will be post-COVID, on meeting the needs of every Rhode Islander. I talk about it all the time. Everyone deserves access to a high-quality, well-funded public education, regardless of race, gender, zip code, or income. Everyone deserves access to high-quality health care. Everyone deserves access to high-quality infrastructure and clean air and clean water. That is doubly so now in the middle of this public health crisis. Now is the hardest time to be poor, to be living on the edge, to be living in a crowded apartment, to not have access to health care, to not have health insurance, to be an undocumented immigrant and be afraid to seek what you need to fulfill your family's health and safety needs. And so because of that, we are really focused on it more than ever. Dr. Alexandra Scott has a long-standing commitment to issues of equity. Her work speaks for itself. It's frankly a lifelong commitment, but her work around health equity zones throughout her tenure as our Director of Health has been outstanding, and she's doubling down on that now. I announced last week that I created an equity considerations working group. As I said, I'm running this operation with a number of working groups, and equity is so important. It's a core of everything we do, but we want to make sure it's front and center. So there's a working group on that, and their job is to make sure that the resources we allocate and the decisions we make always reflect the needs of everyone in our community, not just some people in our community. So for a month or so now, we've had a Latino advisory group. They've been fantastic, helping us to develop our response to meet the needs of the Latino community. By the way, we've come a long way in meeting those needs. We are also, today I'm saying we are also broadening. I want you to know we're broadening that group, not just to the Latino community, but there are other communities as well. So we're adding more, we've been adding more representation of communities of color across the state to the advisory group, to include African Americans, African immigrants, Cape Verdeans, Haitians, Southeast Asians. We really need to bring along all Rhode Islanders, and I'm grateful to the additional members joining our advisory group so you can put the community's needs front and center for us, and frankly, help us to make sure that our resources and our response gets into the community. As we expand this work around equity, I have asked Secretary Wilmazetta Jones to lead that work group and lead the effort around equity. She's a leader in this area. She's devoted her career to the issue of equity in human services, and I have confidence that she will do an excellent job. The updated list of the full advisory group will be posted today. It may be there now. If not, it'll be there very soon on reopeningri.com. It's a long list. I won't read through the names, but reopeningri.com. By the way, if you look at it and you say my community is not represented, then let me know, because that means we have more work to do. Finally, the Secretary of State asked me to make a special note around the presidential primary. The presidential primary will be taking place on June 2nd this year. Obviously, in light of the circumstances, this will be a primarily mail ballot election. It's an important election. It's a presidential election. It is June 2nd, primarily by mail ballot. Tomorrow is the last day to request a mail ballot. We want everybody we want everybody to vote. Yeah, we want you to vote by mail. If you haven't yet requested your mail ballot, do it today, because tomorrow is the deadline. You can go online. You should have received a form in the mail. So maybe somewhere in your mail pile you have a form. Find it, fill it out, send it in today, please, so you can vote. If you didn't, or if you lost it, you can go online to the Secretary of State's website and get the form and return it to your local Board of Canvassers by 4 o'clock tomorrow. So again, it's a disruptive time, but we want the election to go on, and we want everybody's vote to be cast and counted. So please, if you don't have your mail ballot, get that done today or by the latest tomorrow at 4 o'clock. Okay, I'll turn it over to Dr. Alexandra Scott and then come back for questions.
Thank you, Governor. Good afternoon, everyone. Thank you for being with us today. I hope that people were able to enjoy the weekend and the nice weather while also abiding by Rhode Island's social distancing policies and restrictions on groups That is going to be the new way as we go forward for everyone being able to adjust to our new social norm. We know that it's getting warmer out, and we know that people are getting a little stir crazy. So we want to support you in being able to get out in a way that allows you to get some fresh air and allows you to stay safe. We're asking you to keep hanging in there with us for a little longer and definitely incorporate into your everyday normal approach the public health guidance on distancing and groups, 6 feet distance, wearing some form of cloth facial covering, particularly when you're not able to maintain the 6 feet distance, washing your hands regularly, and staying close to the group that you are with. This is such an important time right now. As we've seen throughout this pandemic, and as we saw earlier in April with the holidays for Easter and Passover, the decisions we make as individuals impact the entire state of Rhode Island. To turn quickly to data, we have 121 new COVID-19 cases to report today, as the governor mentioned. There are 236 people who are currently hospitalized. Of those 236 people, 62 are currently in the intensive care unit, and 46 are currently on a ventilator. We unfortunately have 7 additional COVID-19 associated fatalities to report this afternoon. These people range in age from their 50s to their 90s. One person was in their 50s, one person was in their 60s, 4 people were in their 80s, and 1 person was in their 90s. As the governor said, each individual that we have mentioned matters to us and to their families. So our thoughts, prayers, and sympathies go out to the families who have lost precious loved ones. I want to take a moment to recognize all the emergency medical services, EMS professionals throughout Rhode Island. Today marks the beginning of National Emergency Medical Services Week, and there has never been a time when it is more obvious than now how crucial the roughly 4,000 EMS workers in Rhode Island are to the health and well-being of all of our communities. These women and men are on the front lines of this crisis every day, planning, adapting, and responding to take care of us all. EMS professionals are one of the groups in Rhode Island for whom service is a career and a calling. We also acknowledge the fact that it goes the same for nurses, our certified nurse assistants, our pharmacists, primary care providers, our therapists, and so many others who are making tremendous sacrifices every day. We thank you, and we acknowledge everyone at all the hospitals in Rhode Island: Eleanor Slater, Landmark Medical, Roger Williams Hospital, Our Lady of Fatima, South County Hospital, Westerly Hospital, the VA, along with Care New England and Lifespan, all have people who are committed to making sure that everyone stays safe. And before passing things over to the governor, one last point about our work on equity issues. The governor and I have talked a lot about this work to ensure that all Rhode Islanders have an equal opportunity to be healthy, and our work to get resources and communities and resources and supports to the communities that are being impacted the most. When we say it's not just one community in Rhode Island, but all of us, it is more critical than ever now with that message. We need to make sure that all of our communities are receiving the support and resources they need to respond to this pandemic. As Rhode Island, we are one linked community overall. And if we have challenges in one group or groups of people, that means challenges for all of us to tackle together and address, because it does impact all of us. Communication is a major part of this work. We've been doing regular broad outreach in Spanish over the last several weeks and months when it comes to COVID-19, and we've worked to broaden that to reach additional populations of people who do not speak English as their primary language. On our website, health.ri.gov/COVID, we have a link to material in other languages. We are posting updates there daily in a dozen different languages, which we selected based on the language needs of Rhode Islanders: Arabic, Cape Verdean Creole, Chinese, French, Haitian Creole, Hmong, Khmer, Laotian, Portuguese, Spanish, Swahili, and so much more. We are working with community organizations throughout the state to ensure that people who need updates in these languages know how to access this information. That's one piece of many that we incorporate into our equity approach to help ensure that everyone has access to living as healthy as they can live and staying safe within this COVID-19 pandemic. So I'll finish with recognizing and thanking Director Courtney Hawkins and Secretary Womanzetta Jones, Michelle Wilson, and the Health Equity Institute, and all of the members of the team working on equity considerations as a key part to our response. This is the way that we will work to connect all Rhode Islanders going forward. So thank you. Let's get started.
Governor, your remarks on beaches, or your remarks on beaches and salons and churches come on the same day that Governor Baker announced his plans to reopen Massachusetts, and those are 3 areas where now Massachusetts will kind of leapfrog Rhode Island. While recognizing that Rhode Island is still ahead on restaurants and retail, what do you say to Rhode Islanders who look at this, especially because Massachusetts has been more hard hit, and say, how come they're now ahead of us?
Well, they aren't actually ahead of us insofar as they're beginning by opening manufacturing and construction, which we've never closed. They're a little bit ahead on churches, as you say. You know, there'll be a weekend before us on churches. You know, it's a consistent approach, whether you're 1 week ahead or 1 week behind, that everyone kind of has to make that decision. As I said, my team, we're talking constantly to the people on the ground in Rhode Island. You know, the folks who are leaders of faith communities. We're doing today, again, the town hall on hairdressers. It's a judgment call, but I think that it's roughly consistent, which is to say open in phases. And if it's plus or minus a week here or there, I think that that's something you'll see. I would tell you this, and this is the important point, though. My approach, the approach I'm taking, has been to prioritize work, right? We have hundreds of thousands of people collecting unemployment. We have an economic crisis in Rhode Island, so I have said, I kept the social gathering limit low to prioritize getting folks back to work. That's a decision. The other thing, the approach we're taking, which is consistent with every public health expert that I've talked to at the state level, the federal level, at Brown, at Johns Hopkins, et cetera, is you want to make some changes and then leave 10 to 14 days to look at the effects of those changes and then make other changes. And so that's what we're doing. Like, I understand in Massachusetts, they're doing every week changes. That's a different approach. We're taking a different approach. And we are my other primary objective is to only do this once. We want to go slow and steady so we never have to go back a phase. The consequences of having to go backwards, emotionally, financially, to our healthcare are significant. So my approach is slow and steady so we get it right and don't go backwards. So anyway, that's how we're thinking about it. I say we're doing well, and there'll be a few things here or there where we differ by a week or two.
Governor, I'd like to follow up on our conversation from Friday on high school graduations. I heard from a number of parents, I heard from school officials, and what I heard was that your administration is sending mixed messages specifically about wearing masks at these either virtual or in person. Now, the Department of Education website still says you have to wear a mask. A senior official from your administration who's been dealing with the superintendents has been privately saying, well, if they take the mask off, who's going to be around to be able to enforce that? And so the superintendent of West Warwick, I presented that to you the other day, and you said, well, that sounds reasonable, let me get back to you. She called your office Friday afternoon after the press conference, and she said, the governor's office returned my call with the following official response that no new guidance was forthcoming, but that common sense should prevail. Each district should consider the unique and individual needs of their community. And they said, what's different than the three of you standing up there, a parent and a kid coming for a picture, 15 seconds on and off? That's not the official line from your administration. So for the thousands of high school graduates who are ready to go, what's the message about coming up, taking your mask off, getting a picture, and walking off the stage? Is that still a problem?
So let me say this, to the thousands of graduates, whether they be college or high school, my first message is congratulations, and I'm sorry you have to be going through it this way. I will say you'll never forget it. You know, this is going to be a unique way to graduate, and I hope you get as creative as possible and make it memorable and have some fun with it. The Department of Health and the Department of Education have put out clear guidelines. We haven't changed those guidelines, and it's up to every superintendent to figure out how to get creative and have a safe graduation within those guidelines. You know, we're not in the business, and I cannot be in the business of telling everybody exactly, is this okay, is that okay? There are guidelines, they are clear. Superintendents need to look at the guidelines, interpret them, get creative, and make their decisions and do their best. That is what I am telling you.
That's not what they're saying privately. What they're saying,
I
you
don't
gotta
know
look
about
at
that,
this,
but-
but, you know, read between
Yeah.
the lines.
Here's the thing, the fact is, common sense does have to prevail. And I would say that this is gonna be an issue that's gonna come up again and again and again in the next 9 months, right? Like, as I said from the beginning, we have rules to keep you alive and healthy. And it's in your best interest, all of our interest, to figure out ways to follow the rules, not ask how you can get around the rules. Now, you know the rules. You have to stay 6 feet apart. If you can't stay 6 feet apart, you better be wearing a mask. You know it's different inside versus outside. So certain common sense has to prevail.
That scenario that I outlined, you come, you take your mask off for 15 seconds and you go across, you said that sounded reasonable.
To me, it does.
What about Dr. Alexander Scott?
But she doesn't, we don't know all the other details, right? So the thing, and this is why I'm not going to go down the rabbit hole of every single hypothetical. There are guidelines, they are clear. You know, if you're a superintendent, you have a job to do. It's not an easy job. You need to figure it out, get creative, and keep people safe. If you have crowds of kids lining up before they come up, that's a problem. So it's the whole context. Like this, I don't know how many people we have here, a dozen or something, but we're in a huge auditorium. This is safe. So, you know, I think there's ways to be safe and creative and follow the rules.
I'm going to ask you to go down a rabbit hole for a second. You said that folks were generally following the regulations this weekend, but folks on Eaton Street would say that's not the case at, you know, the PC situation. So can you react to that?
Yeah. So thank you for bringing that up. You know, we send out our inspectors who went town to town, shop to shop, and by and large, we saw 90+% compliance, particularly with mask wearing. Way to go, Rhode Island. A week ago, employees were all wearing masks. Not all the shoppers were. We saw much better compliance this weekend, so I want to say thank you. Yeah, the kids, as I get older, they call them kids, you know, the young people, they need to do better. This isn't a joke. And the whole response from us going forward is gonna be more pinpointed. Like we're seeing with communities now, you know, in Central Falls and Providence and Woonsocket, in nursing homes, our whole response is pinpointed. It's not okay for kids to be, or young people or anybody, to be congregating. We heard of a few big birthday parties in different communities this weekend, and we went and shut them down. And we're going to continue to do that.
Just to follow up on it, Providence hasn't issued a single fine yet to anybody. And I know you said that's not the number one goal or anything, but you look at what happened again in the PC area, and I think the average person says, how does no one, you know, face any penalty for that?
That's fair. I think that is fair. We have sent, I know we've sent the state police to deal with parties, and they've been successful at breaking them up without finding folks, or shutting them down before they start without finding folks. So at this point, I have to leave it to the discretion of local law enforcement. They're the ones who are the professionals. They have to balance, they have to de-escalate a situation and get compliance. A fine is a tool in their toolbox to enforce, and we're going to trust them to use their judgment. But it is a tool in the toolbox, and we are serious about this. And by the way, as summer comes, if we start to see big social gatherings, we are going to have to shut them down.
Governor, I'm going to ask though, Narragansett Beach, North Kingstown, at Rome Point, I saw softball teams in uniform having games.
Where?
In Warwick. How does someone who's in an area that's, let's say Central Falls right now, square what's going on in Narragansett and other parts of South County, where there were, civilians moving parking barricades and entering the beach?
Yeah.
How does someone square that with their own experience?
With their own experience. That is,
Problems.
yeah. First of all, that is so frustrating that people would do that. I know this is hard, right? I know we have cabin fever. We cannot fight. It is foolish to think you can trick the virus, outrun the virus, try to get around the rules. If that's happening, 3 weeks from now, we're going to see a problem in that community. Won't happen now. You'll have a good time now. And then 3 weeks from now, a lot of people will get sick. You don't have to be a rocket. Look at what's happening in Sweden. Look at what's happened. Look what happens in other communities in the country or around the world. You don't follow the rules, you get restless, people get sick and die. And then we have to shut down businesses. So I'm sorry to hear that. I didn't know about that. Clearly we have work to do. The other thing is, listen, we want to get to that next phase and then that next phase. So I'm asking folks, as hard as it is, and I know it's hard, just hang in there a little bit longer, because you do have people in Central Falls, in Woonsocket, in Providence. The test positive rates in those communities at some of our inner city sites is nearly 20%. That's a problem. So anyway, how do you square it? I guess I would ask everyone in Rhode Island to really, truly recognize we are all in this together. We are all Rhode Islanders, and just hang in there for your fellow Rhode Islanders. Just because your community is in bad shape, there's one 25 miles up the road that is. And if you follow the rules a bit longer, we'll all be healthier and we can all get back to work.
Governor, at what point do colleges have to take responsibility for their students? So, as we know, a number of the colleges plan to come back this fall, hope to come back. That's going to be a huge influx of kids. At what point is the onus on them?
Yeah, entirely, I would say. I mean, which is to say, if not entirely, substantially. I mean, we have asked all the colleges. Let me say this. I support, if colleges want to come back in September, when they come back, we want to support and enable that. We've asked all the colleges to give to us their reopening plans. We've given them a deadline, I think, for earlier mid-June. We've told them what a complete plan has to look like, and we're going to work hand in hand with them to make that plan happen. And we're going to support them. It's on us, the state, we have to help them with testing. We have to provide them with guidance. We have to help them in any number of different ways. And we will do that. But fundamentally, it's the responsibility of the colleges to themselves create and enforce their own plans around social distancing, online classes, dormitory living. They're going to have to be doing more cleaning, more PPE. Obviously, for the state universities, we'll be able to provide financial assistance to help with that.
Massachusetts slightly ahead of us with churches and salons. What guidance do you want to offer Rhode Islanders who may go to church or go to a hair salon in Massachusetts and then they come back?
Yeah, I hope they don't. I hope they wait another week, because that would be the safer thing to do. But it's the same guidance, you know, if you go to the Stop and Shop in Seekonk, as we've said, is okay. Just be careful and, you know, come home and in Rhode Island, follow the rules in Rhode Island.
And just a quick follow-up on that. You mentioned that Rhode Island, the churches would probably need the next 2 weeks to get ready. Is there a working plan right now? Have they not offered something that would be safe? I think, I'm not exactly sure, but Mass is like 40% full. But do they not have a working plan right now?
That's exactly what we're working through. So we spent last week on it, the weekend on it. We're really close. I think by Wednesday, Thursday of this week, that working plan will be online with a lot more details. The details.
One more with beaches. So Roger Wheeler is not open?
Roger Wheeler's not open.
Governor, you don't want to have your own beach open?
I clearly do not have any pull in this administration.
So Governor, what was the thought between having just those 2 beaches open? If you want to eliminate crowding, why not open more and kind of spread it out a little bit?
A good question, Brian. Now you have a view into my life these days. You know, there's no easy answers. That's exactly a potential risk. Again, I'm relying in my faith in Rhode Islanders not to crowd. Some of it is just operational. This is a heavy lift for Janet Coit and the team at DEM. By the way, thank you to Janet Coit and the team at DEM. They are working double, triple overtime on this. Just today to open Goddard Park and the last few remaining parks is extra. It's a heavy lift to safely reopen even 2 beaches. You know, the extra porta potties, the extra enforcement, et cetera, making sure we have compliance. So it was a balance between getting it right operationally. You could do that more easily with 2 than 5, and the concern that you raise. So that's how we came up with that.
Just to follow up on the beaches.
The East Matunic has a small parking lot, actually. So that's a good thing. That was part of the thinking.
Are you considering waiving fees on beaches all summer at this point?
Probably not.
News.
Yeah, probably. Probably not. It's free. Let me say this. I don't think you can, in good conscience, ask folks to pay for a beach if there's no bathrooms, no showers, no concessions, no lifeguards. But once we get back into the business of having lifeguards, parking attendants, amenities, I think you can get back into the business of having a fee, because frankly, we need to pay for lifeguards, folks to clean, et cetera.
John?
Governor, a couple of weeks ago, your emphasis was really on testing and ramping up the tests. Where do we stand today? And what have you found from your test results? What do you see trending here?
So I'm going to answer that, and then I'd like to have the doctor answer that. I feel very good about where we are with our testing. Now, it is imperfect, okay? But if you look at us compared to really any other state, we're doing better than, in most cases, or just as well as. I can't find any other state who's doing a better job, meaningfully. The area that we still have to continue to get better at is testing in communities that are most affected and doing it in ways that are in the community, and everybody can go and can get their test for free or covered by insurance. We're having very good success with the program at Stop and Shop. People are showing up, people are getting their test. Now that's just to get a broad view of what's happening in Rhode Island. That's not for folks who are sick. So we're overlaying that kind of surveillance testing on top of our symptomatic testing. That is going well. And also the blood testing. So I would say, you know, we have a plan on testing. We want to test anyone who has symptoms within a day of those symptoms and get them results within another day. We want to test broadly in the community like this surveillance test, doing a lot of testing to see what's going on in Rhode Island, what percent of our population has built up antibodies, are there any particular communities we should be worried about? And then outbreaks. We need to be on it on an outbreak. We want to be at the site of an outbreak within 4 hours and have everybody tested within 2 days so we can contain an outbreak. We call it SOS, symptoms, outbreaks, surveillance.
As testing their employees?
Excellent question. It's going to depend on the business. So I'm glad you brought that up. Many large businesses who have like a big corporate campus are probably going to want to do their own on-campus testing. That's because they want to do it. That's because they want to provide that like as a benefit to employees and to develop confidence in their workforce. And if they want to go ahead and do that, that's on their dime, and we'll help them. You know, we're helping them figure out how to do it. Our job is to make sure that every Rhode Islander of every business, big or small, can get access to testing. The place that we are in closest contact with smaller businesses on, particularly manufacturers, is around the outbreak testing. In other words, if there's an outbreak in a manufacturing operation where people work close in space, they need to know from us, we're going to get there and help them, and we're in good shape with that. Did you want to talk about the trends?
To start with the first question that you asked about testing in terms of what we are seeing, over this past weekend, we surpassed 100,000 tests being done. So we are beyond 10% of our population, far exceeding what's occurring in other states. We want to continue to advance that because the more we are able to test and capture the landscape of particularly people with symptoms, the better able we are to quickly get them isolated, contact their direct contacts, and get them quarantined, because that's critical to stopping transmission. The trend that we have been following to help understand that is percent positives. If we're testing enough people, we will start to see over time the percent of people who are positive start to decrease. The focus is being less than 10%. We are that for the state, but we do have, as the governor mentioned, communities that are not less than 10%. And that is where we really want to be focused in pushing resources to those communities, help make sure they have what they need to be able to isolate and quarantine effectively, and to provide the support. Our work is to, going forward, continue to engage with providers that are able to offer an infrastructure that we can leverage for testing. And as the governor touched on with our SOS testing strategy as a state, symptomatics, outbreaks, and then sentinel surveillance, our early warning system, we really want to build out that early warning surveillance sentinel testing system so that we can better understand how disease is transmitted and then engage various sectors, education, work sectors, and others with testing and helping to determine the best way to respond going forward.
Doctor, with the surveillance testing, where do we stand on that? About how many people have accepted the initial 5,000 household invitations? What percentage and how many absolute numbers have been tested? And do you have any results yet? And if not, when do you anticipate a release of those results?
We're continuing to collect the numbers in terms of where we have landed last, but there has been a robust response where people have been interested in participating in the random sampling approach of our testing. And we want to continue to learn from that and expand it further, really build out into the communities that are hardest hit, and we'll continue to share data. There are two benefits that we will get. One is to better understand spread of disease, who's most impacted at a population level, and the other is to help individuals. We've learned and are continuing to emphasize that these tests work best with someone who has symptoms. So if someone does not have symptoms and gets tested as a part of our early warning system, sentinel surveillance testing program, which we are encouraging, we want to make sure they know clearly it's only beneficial if it's positive. That allows us to respond quickly, get them isolated, and reach out to their contacts to be quarantined. If a test is negative, there's much less information we can take from that in terms of changing their behavior. We want people to still stay home if they are sick, and to continue to conduct the social distancing and hand washing and all of the elements that we know are critical to stopping transmission of COVID-19.
Thank you, everyone.
Governor, are you gonna, any outside dining today?
I'm hoping family comes here later this week. I'll let you know.